addictions care in our region. I'll ask my colleague and friend Austin Mixamong, traditional healer at Waypoint, to come up to the podium and provide a blessing. Austin?
Waywana Bojo, Nigan Kutnijnikas, Mongdo Dam, Alchemy Gwechnonga Gimaljiang, Gin Jimnido, Gin Kineo Kanman, Wido Kushnan, Joen Mishnang, Wido Kushnan, Ginio, Gyakchigayang Mampi, Oxio Gumming, Juido Kong, Juido Cook, Kinawaya Mampi Awat, Gin Kineo Kanman, Jimnido, Gwejwinjaquamat, Kinamampi Awat, Ajwem Nishnang Jimnido, Ajwem Nishnang Jimnido, Ajwem Nishnang Jimnido, Ajwem Nishnang Jimnido, Dikangada, Miigwech.
Thank you, Austin, for enriching our gathering here this morning. We're very fortunate to have you at our hospital as the work you do is transformative. We have the profound privilege of gathering on the traditional territory of the Anishinaabe, which includes the Odawa, Ojibwe, and Potawatomi nations, collectively known as the Three Fires Confederacy, the Haudenosaunee, Huron, Wendat, and Métis. We're committed to improving relationships between nations and to partnering with Indigenous health service providers in Central Ontario to advance equity through trauma-informed and culturally appropriate care. It's a great privilege to be joined this morning by the Deputy Premier and Minister of Health, Sylvia Jones, and the Minister of Colleges and Universities and MPP for Simcoe North, Jill Dunlop. I'd like to recognize a few others who are with us: our Board Chair, Ernie Vaillancourt, Board Members Doris Sheriff and Tricia Hutzel, and former board member John McCullough, President and CEO of Georgian Bay General Hospital, Matt Lawson, and President and CEO of Collingwood General and Marine Hospital, Mike LaCroix, Mayor Ted Walker of Tay Township, and Mayor David Evans of Tiny Township. Thank you so much for being here. I'd like to also acknowledge the entire team here at Waypoint. You provide and support compassionate and expert care to some of the most complex and disadvantaged people in the province. I'd now like to ask our special guest, Minister Jones, to come up to the podium.
Well, thank you very much. Good morning, everyone. It is indeed a great honor to be able to come back to Waypoint and join my friend and colleague, Minister Dunlop. And I want to say I am here today because of Jill's advocacy. So you have a strong, strong supporter of Waypoint and your community here. I want to thank everybody for Waypoint for hosting us today and extend my appreciation to the entire team for everything you do to provide exceptional care to patients and their families. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Earlier this year, we launched Your Health, our bold, innovative plan to build a more connected and convenient healthcare system by expanding capacity, reducing wait times, and growing our healthcare workforce to provide Ontarians at every stage of life with access to the care they need, including mental health and addiction services, when and where they need it. With our Your Health plan, we have added 8 new youth wellness hubs that fill the gap in youth addiction services, providing children and youth aged 12 through to 25 with a safe, welcoming space to access the services they need. Invested an additional $425 million over 3 years for mental health and addiction services, including a 5% increase in base funding for community-based mental health and addiction services providers. And we are getting shovels in the ground for over 50 hospital redevelopments over the next 10 years, which will lead to over $48 billion in healthcare infrastructure and add over 3,000 new beds in communities across Ontario. Today, I am pleased to announce that our government is continuing to make it easier and faster for Ontarians to access the services they need by building a new 20-bed inpatient acute care unit right here at Waypoint. This new inpatient acute care unit will expand the urgent and specialized mental health and addiction services that communities around Georgian Bay can access closer to home, connecting more patients and their families to a team of healthcare professionals that provide a full range of services, including psychiatry, psychology, occupation and recreational therapy, and addictions counseling. As our government continues to work on implementing the Roadmap to Wellness, our plan to build a world-class mental health and addiction system, we are adding capacity to meet demand by introducing and expanding innovative new programs and working with healthcare partners to ensure that they have the infrastructure they need to ensure people and families have access to effective and convenient mental health and addiction services to support them on their journey to wellness. This exciting announcement today, building a new inpatient unit at Waypoint, is another way our government is making it easier for Ontarians to access connected and convenient services in their community close to home. Thank you again to everyone at Waypoint and all the healthcare workers across the region for everything you do to support your communities, providing care to patients and their families every day. And I will now be pleased to turn the podium over to Minister Dunlop. Thank you and stay well.
Well, good morning, everyone. Bonjour, Ani. Thank you, Austin, for starting us in a good way this morning. And thank you for the kind introduction, Minister Jones. And thank you to all that have joined us here this morning to share in this wonderful announcement for Waypoint Centre for Mental Health Care and the communities it serves. I stand before you today with great excitement and pride to share in this announcement, a development in our region's mental health care services. Today, I'm thrilled to share the news of the significant capital investment that will undoubtedly enhance the well-being of many individuals and their families. This allocation of funds for the brand new 20-bed inpatient unit for urgent and specialized care at Waypoint marks a milestone of crucial steps in our commitment to fostering mental health and wellness in our communities. Mental health is a cornerstone of our overall well-being, and Waypoint has long been a beacon of hope and healing for those facing mental health challenges. With this new inpatient unit, we are furthering our dedication to providing timely and accessible care to individuals in crisis. This enhancement will not only expand the capacity of Waypoint, but also ensure that those in urgent need of mental health support receive the attention and care that they deserve. Working closely with past President and CEO Carol Lambert and now Nadia Sundarji as President and CEO, along with her team and the Board of Directors at Waypoint, I know the new 20-bed inpatient unit will be staffed by compassionate and skilled professionals who are committed to making a positive impact on the lives of those seeking help. By investing in mental health infrastructure, we are sending a clear message. Mental health matters, and our communities are committed to supporting each and every individual on their journey towards recovery, with the new inpatient unit serving as a sanctuary for healing, providing a safe and nurturing environment for those in need. I would like to express my gratitude to Minister Jones and to all of those who have tirelessly advocated for improved mental health services for our communities of Simcoe North and the region. Your voices have been heard, and today's announcement reflects our shared commitment to building a healthier and more compassionate society. In closing, let's celebrate this momentous occasion as we take a giant stride forward in prioritizing mental health care. Together, we are shaping a community that values and nurtures the mental health and well-being of all its members. And at this point, I would like to now invite Patient and Client and Family Council Executive Director Yvette Brooks to the podium to say a few words. Thank you. Merci. Miigwech.
Thank you for having me here today. The Patient, Client and Family Council, or PCFC, is an organization staffed entirely by people with personal experience of mental illness and addiction. We've partnered with Waypoint for many years, and now, under Nadia's leadership, our lived experiences and perspectives are being actively sought in all areas to guide service improvements for patients and families. Being asked to share this great moment is an example of the partnership that exists. This funding announcement is really good news. We're just coming through a pandemic that was tough on all of us. For people struggling with mental illness or addiction, it was an added challenge on an already difficult journey. The additional beds and services that this funding will provide ensures there is capacity in a safe and caring environment where people can get the extra help that they need. And it's not just people living with mental illness or substance use disorder that benefit from today's announcements. We know that mental illness can affect anyone at any time, regardless of age, gender, or culture. Unfortunately, that means the odds are good that everyone here at some point will be supporting someone who's struggling. It can be heartbreaking sitting in the emergency department of your local hospital with your loved one, wanting to help, not knowing how, or what you can do to keep them safe. With this funding, that heartbreak can be lightened a little, knowing that there is an opportunity for your loved one to come to Waypoint for specialized services, backed by a dedicated research institute, and be provided with the expert care that they need. Yes, this announced funding will provide beds, services, innovative and compassionate care, which is fantastic news. It will improve lives, and in some cases, it will save lives. But in my opinion, it also provides something else for all of us, hope. And for that, I'm truly grateful. Thank you.
Thank you, Yvette. We like to think we have something special in Simcoe Muskoka in the way that we work together as partners. And today's announcement reflects a shared commitment to better care for individuals in our region with mental health and addictions needs. This 20-bed acute mental health unit is an investment in the system and will enable Waypoint as a regional center to support patients throughout Simcoe Muskoka and the surrounding area with the specialized and expert care they deserve. The unit includes the first psychiatric ICU beds in our region for individuals with increased risk due to severe mental illness. And this is such an important milestone towards delivering safer care and relieving pressures on emergency departments of our 8 partner hospitals throughout the region. As collaborative leaders and innovators in the system, we've also created an urgent care pathway with several emergency departments that connects people with timely outpatient psychiatric care, offers alternatives to admission, and alleviates ED pressures. We look forward to further spreading this service and connecting it up with community crisis services as well. Recognition is an important part of the Waypoint Way, and it's my pleasure now to recognize a few of our people for their extraordinary contributions this year. Stephen Glennie is an occupational therapist and was nominated in the innovation category of our 2023 Core Value Awards and is one of our recipients of the Teamwork Award. Stephen's unwavering commitment to improving the lives of our patients has led to the implementation of diverse programs and services and inspired his colleagues and fostered an environment of caring and collaboration. Congratulations and thank you, Stephen. All right, Alyssa Hansford is a business intelligence lead and was nominated in both the collaboration and accountability categories. She's among our participants in the Pursuing Equity Learning Network, which is a North America-wide learning collaborative, and she created our Equity, Diversity, and Inclusion Data Dashboard to enable quality improvement. Congratulations and thank you. Dr. Achal Mishra is our Medical Director of Forensic Programs, and he's this year's recipient of the Patient Safety Award for his innovative approaches to improving patient experience, which are leading to safer care. His contributions stand out for their excellence, and they really exemplify Waypoint's deep commitment to patient-centered care. Congratulations and thank you. Celissa Vipond is the recipient of the Innovation Award for her work with the Ontario Structured Psychotherapy Program, for which Waypoint is one of 10 network lead organizations across the province. Celissa's focus on equity has helped us reach people who traditionally face barriers to accessing psychotherapy and deliver top-notch patient outcomes. Thank you, Celissa. And Larry Silk is a psychometrist with the Bayview Program for Dual Diagnosis, bringing caring and professionalism towards serving patients with developmental disabilities and complex mental health needs. He's being recognized for a remarkable 45 years of service to Waypoint and our patients. And last but not least, Nicole Mace is our Director of Human Resources and Organizational Development. Mission-driven and strategic, Nicole's leadership of initiatives aimed at healthcare worker wellness all across Central Ontario is making a positive impact on staff, leaders, and the patients' families and communities that we serve together. Congratulations, Nicole. In closing, thank you so much, Minister Jones and Minister Dunlop. We're grateful to you and the Ontario government for working with us to address the growing needs for mental health and addictions care in Simcoe, Muskoka. We have a small token of our appreciation. These are handmade by our patients. To everyone joining us here to share in this exciting news for our region, thank you, merci, miigwech. Have a wonderful day and a joyous holiday season. We're now going to open up for Q&A with Minister Jones. Thanks.
All right, we'll now move over to take questions from the media. Media present can line up behind me at the microphone. As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question.
Hi there, Christian Davino with CTV News. I'm just wondering what the dollar figure for this investment is and how much the total project is going to cost.
So because it is an existing build within the bricks and mortar that are here, we're essentially repurposing an existing part of the facility. After the request for proposals and the tendering goes out, then we will be able to release the dollar figure. Until we do, we're tipping our hands to individuals who are interested in bidding.
And Dr. Sundarji spoke about diverting patients from emergency rooms. Obviously, that's a big issue for crisis care right now. How does this fit into that plan?
Sure. So during the pandemic, Waypoint has been temporarily operating an additional 14 acute mental health beds over and above our permanent unit of 20. This project will take that 14 to another full 20 and make it permanent. And also by including those psychiatric ICU beds, which are the ones that are most scarce in the region and lead to delays in people waiting in emergency departments for the right level of care for them. This will expand our overall capacity and improve flow, especially for those who are most severely ill.
Thank you.
Thanks.
We'll move over to our next question if we have one. And not seeing one, that concludes our media availability. Thank you everyone for coming.